word to Dr. Nidhi. Dr. Nidhi Patwardhan is consultant at Nandadi Pai Hospital, Sangli, and she will be speaking about unsatisfied patients after EDOF implantation.
Thank you, Dr. Saurabh. So you have done the perfect surgery according to you, but the patient is unhappy. So let us investigate it. Lots of points have been covered already, so I'll be covering them fast. As we know, the surgery of the multifocal and EDOF starts before the surgery, the main preparation. So the most important thing is the counseling, and counseling. So whether you are taking into consideration the patient's occupation, his visual needs, his hobbies, and his expectations from the surgery and the IOL, this is the most important point. For example, if the patient wants to do daily night driving and you are recommending EDOF lens, then the patient might not be happy. Or if the patient demands that he wants to have daily extensive near reading without any glasses, and still you are not clear and giving a EDOF lens without any preparation, then the patient might be standing on your head. Then the possibility of glares and halos, if it is explained early to the patient, it has been shown that the patients are more accepting. And of course, this is important that if there is any organic pathology, it has to be tested before, because any pathology which is found out before the surgery, it is a patient problem. But if it is found out later and you tell the patient that you have a thin ERM and therefore the quality of your distance vision is less, then it becomes your problem. Now, regarding the neuroadaptation, in some patients, still there may be some neuroadaptation, especially with the complaints of night vision disturbances and some adaptability to do near vision tasks. So, if you explain to the patient beforehand, it has been found in studies also that these patients have a better acceptability of the EDOF lenses. And multiple studies have shown that although the intensity of glares and halos in EDOF lenses are less, but still they are present. Then the surgical factors. But was the surgery actually uneventful? We might be able to get away with some surgical mistakes in monofocal lenses, but you need to have a clear cornea with no inflammation and a quiet eye. Ensure that the lens is properly in the bag, no haptic is out of the bag, and if there is a toric lens, that it is properly in the axis. Now the post-op factors, there are two main factors, the residual astigmatism and the residual error, and the dry eye. If there is any dry eye, it needs to be corrected and treated. Most important factor which has been found in multiple studies is the residual refractive error and astigmatism. It is the most common reason which affects everything, both the near, intermediate and the distance night vision. If it is a high refractive error because of bad biometry, then sometimes very rarely IOL exchange might also be needed. And you might give an option to the patient for post-op astigmatism for LASIK or PRK. In case of a toric IOL, if there is a residual cylinder, it is better to investigate early and do the intervention. In some cases, there might be early PCO or a post-surgical CME, so it is better that you investigate fully and examine the patient clearly without having any preconceived notions. Still, if you find that after following all these steps, none of these issues is present, it is still better that you listen to the patient with an open mind. Sometimes they just want to get you to listen. And always any surgeon who implants a premium lens should always be confident in exchanging or removing the lens. If nothing, it gives the patient confidence in the surgeon that if anything happens, the lens can be exchanged. Thank you.
Thank you, Dr. Nidhi. So I would like to ask the panelists about unsatisfied patients. So if you have any particular experience to share, and also if any of you have done IOL exchange for unsatisfied EDOF patients so far. Nitin?
The journey with EDOF has been quite satisfactory, and I really hardly have any unsatisfied patients. One case I just remember is many times when patient has monofocal in first eye, I do give option of EDOF for the other eye, and most of these lenses work really well in combination with a monofocal in one eye. One of the patients I implanted a central near dominant lens with a central near dominant zone, and patient was complaining of ghosting in that eye. But eventually eventually he settled down. But you know, these things can happen, and counseling is very important. You have to tell the patient that it's when patient tries to see binocularly, compare eyes, then they sometimes fall in trouble. So this was the only patient that I experienced, and you have to be little careful with these lenses with a central bump. If it is a very prominent bump with a refractive component, then you have to counsel the patients well. But whatever lenses I have shared, 6 lenses, all of those are doing extremely well. And some of the patients do have problems like dry eye or post-op residual error, and Nidhi has already elaborated how to manage them. So treat dry eye well. If there are any residual issues, do a offer PRK. And I don't have any experience of exchanging them. Most of the patients will have.
Yes, Sean.
It's not about the lens, but after counseling, after doing everything, I still remember I operated one of the lawyer and I put EDOF. And you know how, and the same lawyer got some refractive error, and he had searched all the Google, and I have to explain him, see whatever it, because after every counseling I just write one thing, whatever we did best, but you may need to have little bit refraction. So that little bit, a last line save me, and that lawyer is satisfied because I operated another eye. So this is my experience.
Thank you, Sean. Yeah, Dr. Chetan. Mix and match. Yes, I think that's a very good option for to consider. Though I personally have not mixed and matched of any of my patients so far. So the one problem which I feel with mix and match is if they start comparing the two eyes. So you have to, I think, pre-op counseling, and of course you are saying that he is not happy with the eye. Yeah, second eye. Yeah. Yes. Yes.